Hello everyone. Today we're discussing the anatomy of the pharynx. So as we all know, the pharynx, it is a muscular membranous tube. It extends from the base of the skull up to C6 vertebrae. So this is C1, C2, C3, C4, C5 and C6. So the pharynx extends from C1 to C6. So this is the pharynx. Now let us see the external relations of the pharynx. The pharynx communicates above with the body of the sphenoid and the basilar part of the occipital bone. Behind, it communicates with the anterior arch of atlas, that is C1, C2, C3, C4, C5 and C6. So that is the relation posteriorly. Anteriorly, the pharynx is deficient. It communicates with the nasal cavity and the oral cavity and the larynx. Below, it continues as the esophagus. So these are the external relation of the pharynx. Now the pharynx is divided into three parts, namely nasopharynx. So this is the nasopharynx, this is the oropharynx and this is the laryngopharynx. So these are the three parts of the pharynx, namely nasopharynx, oropharynx and the laryngopharynx. Now we will see the posterior aspect of the pharynx. All these are the pharyngeal muscles. If we incise these muscles and reflect them, this is what we see. So as already discussed, the pharynx communicates with the nasal cavity through the cornea. It communicates with the oral cavity through the oropharyngeal isthmus. The boundaries of this oropharyngeal isthmus is above by the soft palate, below by the dorsal surface of posterior one-third of the tongue, on either side by palatoglossal arch. Now, the pharynx communicate with the larynx through the laryngeal inlet. Now we will see about the nasopharynx. As already discussed, this part is the nasopharynx. It extends from the base of the skull up to the soft palate. So we will see the relations of this nasopharynx. So, anterior wall of the nasopharynx is deficient and it communicates with the nasal cavity. Let us see the roof and the posterior wall of the nasopharynx now. So, this is the roof and the posterior wall of the nasopharynx. So, the roof and the posterior wall of the nasopharynx is formed by the body of the sphenoid, basilar part of the occipital bone, anterior arch of C1 and C2. So that is the boundary of the posterior wall and roof of the nasopharynx. We have already discussed the anterior wall. We have also discussed about the roof and the posterior wall of the nasopharynx. Now, the feature of the roof and the posterior wall of the nasopharynx is this pharyngeal tonsil, which is present here. So that is the pharyngeal tonsil. So what is this pharyngeal tonsil? It is aggregate of lymphatic tissue underneath the mucosa of the pharynx. Sometimes what happens is this pharyngeal tonsil gets enlarged when it is infected and thereby it obstructs the passage of air and such children are forced to breathe through the mouth. This pharyngeal tonsil, it is prominent in children and it atrophies in adults. So as already discussed, when this pharyngeal tonsil gets infected, it enlarges and obstructs the nasal cavity. So such children, they are forced to do mouth breathing. These children have a characteristic face that is called as adenoid face. That is called as adenoid face. Now, what is the feature of this adenoid face? Their face will be long, narrow, and their mouth is always open so that they can breathe in air. So that was about the pharyngeal tonsil, which is the feature of the roof and the posterior wall. Now, we will see the feature of the lateral wall of the pharynx. As you all can see, there is something opening here in the lateral wall of the pharynx. This is known as the pharyngeal opening of the eustachian tube. So you all can see here, this is the eustachian tube. So this is the eustachian tube, as you all can see. So this is the eustachian tube. The one end of the eustachian tube opens in the pharynx and the other end communicates with the middle ear. The function of this eustachian tube is to communicate the air with the middle ear and the pharynx and to maintain equilibrium of air pressure. So that was about the eustachian tube, pharyngeal opening of the eustachian tube, which is a feature of the lateral wall of the pharynx. Now, uh, some of us have experienced ear pain during takeoff and landing. Why does this occur? We will see that. So what usually happens is there is difference in air pressure between our middle ear and the cabin pressure inside the flight. So what happens is this eustachian tube, whose one end is opening into the lateral wall of the pharynx, it gets closed. Thereby, the pressure equilibrium is not maintained. So now, in order to open the closed eustachian tube, there should be repeated act of swallowing, yawning continuously, so that this closed eustachian tube will open, and thereby equilibrium of air pressure is maintained between the middle ear and the pharynx. So that is the feature of the lateral wall of the nasopharynx. Now we will see about the floor of the nasopharynx. The floor of the nasopharynx communicates with the oral cavity through the pharyngeal isthmus. Now, what is a pharyngeal isthmus? It is present here. The boundaries of pharyngeal isthmus are anteriorly by posterior border of the and the free margin of the soft palate, and posteriorly by palatopharyngeal sphincter, and below on either sides by the palatopharyngeal arch. So that is the pharyngeal isthmus. So the floor of the nasopharynx, we have the floor of the nasopharynx. Through the floor, the nasopharynx communicates with the oral cavity, and we have also discussed about the pharyngeal isthmus here and also the boundaries. So that was about the nasopharynx. So we know the extent of nasopharynx from the base of the skull to the soft palate. We know the walls of the nasopharynx. This is the anterior wall, and we know the roof and the posterior wall. We also know the lateral wall. We also know the floor. So that completes the nasopharynx. Now next we will see the oropharynx. So as already discussed, the pharynx communicates with the oropharynx through the oropharyngeal isthmus. The boundaries are the soft palate and the dorsal surface of posterior one-third of the tongue. On either side, we will have the palatoglossal arch. So this is the oropharynx. The pharynx communicates with the oral cavity through the isthmus, oropharyngeal isthmus. Now we will see the features of this oropharynx. The features are as seen in the lateral wall. We are seeing this palatine tonsil. On either side of the palatine tonsil, we are having the palatoglossal arch and the palatopharyngeal arch. This is the palatoglossal arch and the palatopharyngeal arch. The extent of this oropharynx is from the soft palate to the upper end of the epiglottis. So this is the oropharynx. Next we will see the laryngopharynx. So the laryngopharynx is in between the epiglottis till the C6 or the lower border of the cricoid cartilage, still here. So that is the laryngopharynx extent. We will see that in the next slide. So the extent of laryngopharynx is between the upper end of the epiglottis till the C6 or the lower border of the cricoid cartilage. So that is the laryngopharynx. The pharynx communicates with the larynx via the laryngeal inlet. Next we will see about the structure of the pharynx. The pharynx, it is made from inside out. It consists of mucosa. Then we have the submucosa. Then we have the pharyngeal aponeurosis, which is also called as the pharyngobasilar fascia. The feature of this pharyngobasilar fascia, it is thickened above, and as it passes below, it diminishes and vanishes, especially below the superior constrictor muscle. Now, after the pharyngobasilar fascia, we have the muscle layer, the pharyngeal musculature. So, this pharyngeal musculatures are divided into two groups. We have the inner longitudinal and outer circular layers. And on the outermost, we have the buccopharyngeal fascia. So, these are the layers or the structure of the pharynx. So, we have the mucosa, we have the submucosa, then we have the pharyngobasilar fascia or the pharyngeal aponeurosis, then we have the muscular layer, then we have the buccopharyngeal fascia. We will discuss about this in detail. So, as already discussed about the muscles of the pharynx, we have the inner longitudinal. So, this is the inner longitudinal and the outer circular layer. The outer circular layers are mainly constrictors. They are superior constrictor, middle constrictor, and the inferior constrictor. The inner longitudinal muscles, namely stylopharyngeus, salpingopharyngeus, and palatopharyngeus. So, these are the muscles of the pharynx. Now, in the next slide, we will see in detail about these constrictors of the pharynx. Here we can see that the constrictors, namely superior constrictor, middle constrictor, and the inferior constrictor, they are reinforced. They are placed one above the other. Thereby, they maintain the strength. It just looks like the flower vase which is placed one above the other. So, this is how the outer circular or the constrictor muscles are placed. We will see these constrictors, their origin, insertion, and their action. Starting with the superior constrictor. So, this muscle here is the superior constrictor muscle. Let us see the origin of the superior constrictor muscle. It arises from the lower part of the posterior border of the medial pterygoid plate. So, this is the lower part of the posterior border of the medial pterygoid plate and the pterygoid hamulus. It then passes through the pterygomandibular raphe, which is attached from the pterygoid hamulus till the mandible, that is behind the third molar tooth. In the mandible, superior constrictor is attached to the upper and the posterior aspect of the mylohyoid line. So that is the attachment of the superior constrictor muscle. Now let us see the insertion of the superior constrictor muscle. The uppermost fibers will pass upwards and forwards and they are inserted into the pharyngeal tubercle. So this is the pharyngeal tubercle. If you all can see, there is a gap between the base of the skull and the superior constrictor. This gap is called as sinus of Morgagni. It is called as sinus of Morgagni. There are some structures passing inside. We will see about it later. Now, the middle fibers of the superior constrictor muscle, they pass horizontally backwards and they are inserted into the median fibrous raphe. The lowermost fibers pass downwards and backwards and they are reinforced by the middle constrictor muscle. They pass down up to the level of the vocal fold. So that is about the origin and insertion of the superior constrictor muscle. Now we will see about the middle constrictor muscle. So this is the middle constrictor muscle, as we can see. Let us see the origin of the middle constrictor muscle. It arises from the upper surface of the greater cornu and the adjoining lesser cornu of the hyoid bone. It also arises from the lower part of the stylohyoid ligament. Lower part of the stylohyoid ligament. If you see properly here, this is the stylohyoid ligament. So, this is the stylohyoid ligament which extends above from the styloid process below to the hyoid bone. So, the attachment of the middle constrictor muscle, it is from the upper surface of the greater cornu of the hyoid bone and the adjoining lesser cornu of the hyoid bone and lower aspect of the stylohyoid ligament. Now, these fibers, the upper fibers, they pass upwards and forwards and insert into the median fibrous raphe almost up to the level of the pharyngeal tubercle. Now we will see the middle fibers. The middle fibers, they are inserted into the median fibrous raphe, whereas the lower fibers, they pass downwards and they are reinforced by the inferior constrictor muscle, and these lowermost fibers, they reach up to the level of the vocal folds. So that was about the middle constrictor. Now we will study the inferior constrictor muscle. The inferior constrictor muscle, it consists of two parts, the thyropharyngeus and the cricopharyngeus. Let us see the origin and insertion of these two muscles. Thyropharyngeus muscle arises from the oblique line on the thyroid cartilage and also the inferior corner of the thyroid cartilage. These fibers pass upwards and backwards and they inserted into the median fibrous raphe. Now we will see about the cricopharyngeus. Cricopharyngeus arises from the anterior lamina of the cricoid cartilage. These fibers, if you see, they pass horizontal, they mingle with the opposite fibers, and these cricopharyngeus, they form a sphincter which is always closed except during deglutition. So that was about the inferior constrictor muscle. So it consists of two parts, thyropharyngeus and the cricopharyngeus. Having said about the origin and insertion, next we will see about the actions of these constrictor muscles. So the superior constrictor, so we know that the superior constrictor, middle and the inferior constrictor, they contract reflexly and they bring about wave of peristalsis so that they can push the bolus down. Now the thyropharyngeus, this is propulsive in action, whereas the cricopharyngeus is sphincteric in action. So thyropharyngeus is propulsive, it means it pushes the bolus down, whereas cricopharyngeus is sphincteric in action. Now, when thyropharyngeus muscle contracts, the cricopharyngeus muscle should relax. In the next slide, we will see that all the constrictors, the superior, middle and inferior, they have great strength because they are overlapped by each muscle except the inferior constrictor, wherein the in between the thyropharyngeus and the cricopharyngeus there is no overlapping of the muscle. So this area, that is in between the thyropharyngeus and cricopharyngeus, there is an area of weakness which is known as dehiscence of Killian. We will see it in the next slide. So the weakness in between the thyropharyngeus and cricopharyngeus, this weakness is known as Killian dehiscence. Now usually what happens is during swallowing, when thyropharyngeus muscle contracts, the cricopharyngeal muscle must relax. But during some neuromuscular incoordination, what happens is both the thyropharyngeus and the cricopharyngeus will contract together. Therefore, the pressure inside is increased and it pushes the pharyngeal mucosa outwards. That is called as a pharyngeal diverticulum. So that was about the Killian's dehiscence. Now in the next slide, so far we have discussed about the outer circular muscle layer. Now we will see about the inner longitudinal muscle coat. The inner longitudinal muscle coat are three muscles, namely stylopharyngeus coming from the styloid apparatus, and salpingopharyngeus coming from the tubal elevation, and palatopharyngeus coming from the palatine aponeurosis. If you see here, this is the salpingopharyngeus coming from the tubal elevation, palatopharyngeus coming from the soft palate, stylopharyngeus coming from the styloid process. All these three muscles near the insertion, they are joined and they are attached to the posterior border of the thyroid cartilage. So that was about the longitudinal muscle coat. We will see the origin and insertion of each muscle. Now first we will discuss about the stylopharyngeus muscle. So this is the stylopharyngeus muscle. This muscle arises from the medial surface and base of the styloid apparatus. It reaches the pharynx, passing in between the superior constrictor and the middle constrictor. Then it joins with the other two muscles, namely salpingopharyngeus and the palatopharyngeus, and it gains attachment into the posterior border of the thyroid cartilage. So we have discussed about the stylopharyngeus muscle. So this is the stylopharyngeus muscle. Now we discuss about the salpingopharyngeus. Salpingopharyngeus muscle arises from the tubal elevation. It passes underneath the salpingopharyngeal fold and it joins with the palatopharyngeus and the stylopharyngeus muscle, and it's attached the posterior border of the thyroid cartilage. Now we'll discuss about the palatopharyngeus muscle. As already seen, this palatopharyngeus muscle has two fasciculi. We will see them in the next slide. So this palatopharyngeus muscle, it has anterior and the posterior fasciculi. Both the anterior and the posterior fasciculi, they arise from this green color palatine aponeurosis. Both the fasciculi join with each other and they run posterolaterally. And as it descends, uh, it is under cover of this palatopharyngeal arch. Then it joins with the salpingopharyngeus and stylopharyngeus and attached to the posterior border of the thyroid cartilage. Now, before it joins with other muscles for its insertion, few fibers of the palatopharyngeus muscle, they hook back under the mucosa of the pharynx and they form a U-shaped sling that is called as the palatopharyngeal sphincter. In the next slide, we will see about before that, we will see the actions of these longitudinal muscles, namely the stylopharyngeus, salpingopharyngeus, and the palatopharyngeus. During swallowing, these longitudinal muscles, they elevate the larynx and thereby shorten the pharynx. So that is about the actions of these longitudinal muscles. They also close the pharyngeal isthmus. Now, we will see what are the structures. We will see the structures which are passing in between the muscles of the pharynx. That is in between the constrictors. As you all can see, in between, as we already discussed, the sinus of Morgagni, which was a space above the superior constrictor and the base of the skull, that was in between. That space was called a sinus of Morgagni. Let us see what are the contents passing in between the superior constrictor and the base of the skull. So we have the eustachian tube. We have a muscle which is called as levator palati muscle, levator veli palati. We have an artery that is called as ascending palatine artery and also palatine branch of ascending pharyngeal artery. All these are the structures present in between the base of the skull and the superior constrictor. So what they are the eustachian tube. We can see it here. They are the eustachian tube, a muscle namely the levator veli palati muscle, ascending palatine artery and pharyngeal branch of palatine branch of ascending pharyngeal artery. Now we will see the structures passing in between superior constrictor and the middle constrictor. We will see the structures passing between the superior constrictor and the middle constrictor. So mainly a muscle named stylopharyngeus accompanied by glossopharyngeal nerve. Stylopharyngeus muscle and glossopharyngeal nerve. Now we will see the structures in between the middle constrictor and the inferior constrictor. So there is internal laryngeal nerve, superior laryngeal artery. Now below inferior constrictor we have recurrent laryngeal nerve and inferior laryngeal artery. So these are the structures passing in between the pharyngeal muscles. Now let us see the nerve supply of these pharyngeal muscles. All the pharyngeal muscles are supplied by the cranial part of the accessory nerve via the pharyngeal plexus except the stylopharyngeus, which is supplied by the glossopharyngeal nerve, except the stylopharyngeus supplied by the glossopharyngeal nerve, and also the inferior constrictor, which is supplied by external laryngeal nerve and the recurrent laryngeal nerve. So this was about the pharynx. Thank you for watching the video.